let us understand the stages. Like I've mentioned, these are the stages mentioned in books other than squad prop, but this is something that we got to at least understand the basics of. So the first stage is called as stage of tubal occlusion. So what happens in the stage of tubal occlusion? There is some pathology in the nose or nasopharynx that is not letting the eustachian tube get ventilated. So when the eustachian tube is not getting ventilated, what would happen to the middle ear pressure? There would be a negative middle ear pressure. And negative middle ear pressure would result in what? It would result in symptoms. So let us understand. So if this is the middle ear, this is the eustachian tube. Now, whenever there is a eustachian tubal obstruction, could be because of nasal pathology, could be because of nasopharyngeal pathology. Typically, it usually follows an upper respiratory tract infection. So, usually it follows a URTI. So, whenever the eustachian tube is obstructed, there is a negative pressure in the middle ear. Now, this negative pressure in the middle ear will cause what to the tympanic membrane? The tympanic membrane will be pulled inside. And as a result, the patient may have some symptoms. What are the symptoms that the patient can experience in this stage of the disease? The patient can have pain and the patient can have a blocked sensation in the ear, suggestive to you of a hearing loss, which is conductive type of hearing loss. Now, are these symptoms severe? No, they are mild symptoms. On examination, what would you see? On examination, you will see there that there is mild retraction of the tympanic membrane. So, since the disease has just started, the eustachian tube has just got blocked, there is a negative pressure in the middle ear. That negative pressure is acting in the middle ear to cause symptoms of pain and block sensation, and there is a mild retraction of the tympanic membrane. Now, if the patient presents to you at this point of time, maybe giving decongestants, maybe giving analgesics and antibiotics should help to certain extent. But if the patient doesn't present to you in this stage and the disease progresses, where would it lead us to? The next stage is called as stage of pre-suppuration. So, what happens in this stage of pre-suppuration? Here, the middle ear is having obstruction which is continued because the eustachian tubal obstruction is not relieved. There is a negative pressure in the middle ear and this negative pressure is only increasing and increasing. So, there is a building up of negative pressure. So, what do you think would happen to the tympanic membrane? The tympanic membrane would get grossly retracted. So, when the tympanic membrane is grossly retracted, how would it look like? It would look like as though the blood vessels are radiating from periphery to center. Correct? Yes. So, this appearance we call it as cartwheel appearance. Now, at the same time, we will also see that there is serous effusion that is accumulating in the middle ear. So, whenever there is some serous fluid that is also accumulating in the middle ear, you can also see in some situations that the tympanic membrane may be bulging as well. So, certain areas where you see bulge and certain areas where the blood vessels are radiating from periphery to center, which we call it as cartwheel appearance, may be seen. Now, what would be the symptoms in this patient? Now, the patient will have pain. The patient will have a conductive type of hearing loss, but this is a moderate to severe pain. Because the pressure is building, there will be a moderate to severe pain. There will be a conductive hearing loss, and if the effusion has got infected, the patient will have fever. If the effusion has not got infected, the patient will not have fever. So, here you will have fever could be present or could be absent. So, pain, conductive hearing loss with or without fever. Now, if the patient takes therapy during this stage of the disease, the condition can actually get even better. But if the patient doesn't come to you during this phase of the disease and if the disease progresses, what would it result in? It would result in the next stage, which is called as stage of suppuration. What is happening in the stage of suppuration? The middle ear is having again negative pressure because the eustachian tube is blocked. This negative pressure is building up in the middle ear and the effusion is also building up in the middle ear. Now we also see that there is ascent of organisms into the middle ear via the eustachian tube, and this effusion is getting infected as well. So when there is effusion which has got infected, what will we see? What would be the symptoms in the patients whenever you have got an infected effusion? The patient would present to you with mild pain, moderate pain or severe pain. Yes, the patient would present to you with severe excruciating pain. Along with severe excruciating pain, will the patient have hearing loss? Yes. But now will the patient have a high grade fever because the effusion in the middle ear is an infected effusion? Yes. So they will have pain, they will have fever, they will have a conductive type of hearing loss. Now on examination, what is it that you will see? On examination, the tympanic membrane is red, congested, and you can see it will be bulging outwards. So like this, you can see a bulging tympanic membrane. Now during the same time, the tympanic membrane may rupture and the pus may come out. So when the pus comes out, you will see there is a rupture of the tympanic membrane and the pus is coming out and there may be discharge of pus. Now, when the pus is getting discharged, it can be taken into stage of suppuration, but some books mention it to be in stage of resolution as well. But whatsoever it be, it's a pathology that we see in ASO. Now, the pus that comes out of the middle ear will come out in a pulsatile form. It doesn't come simply like that. It comes in a pulsatile form. Why is it coming in a pulsatile form? Because the perforation in the tympanic membrane is very small. The amount of pus in the middle ear is quite huge and that is coming under pressure. So, what do you get here? You get here pulsatile otorrhea. So, what will you see? You will see pulsatile otorrhea. This pulsatile otorrhea will reflect light. So what will happen? It will reflect light. How does it reflect light? Because you're wearing a headlight and examining the ear. So when you're examining the ear, the pus is coming in a pulsatile form. So when the bout of pus comes, you'll get a light reflection back. And the next moment, there is no bout of pus, so you don't get a light reflection back. So you get a reflection and then no reflection, a reflection and then no reflection. That condition, we call it as pulsatile otorrhea. And if it reflects light, we call that sign as a lighthouse sign. Now again, these are not names mentioned in book like Scott Brown, but yes, because there is a mention in other books, I'm just telling to you. So this sign is called as lighthouse sign. So there is pulsatile otorrhea and this pulsatile otorrhea will reflect light and that sign is called as lighthouse sign. Now this can be taken in resolution or in suppuration as well. So we know the symptoms are primarily excruciating pain, fever and hearing loss. The signs that we can see in the tympanic membrane could be a bulging tympanic membrane or there can be a perforation. And you see that there is pulsatile otorrhea that reflects light, that is called as lighthouse sign.